Welcome, everyone. Thank you very much for joining us today. Hopefully you're in the right place. You have joined the Dementia Australia Research Foundation webinar about involving people with a lived experience in research. My name's Sarah, and I'm the Consumer Engagement Coordinator for Research here at Dementia Australia. Before we get into the speakers, I'd first like to acknowledge the traditional owners of the lands that we're meeting on today. I'm on Kaurna land and pay my respects to their elders past and present, and also extend that respect to other Aboriginal and Torres Strait Islander peoples here today. So as you know, hopefully know, the annual Dementia Grants program opened on the 3rd of June. So nearly 2 weeks ago. And so this webinar has been organised to provide some information to researchers, people who are thinking about applying for a grant this year, to support them and give them information about the best ways that they can involve people with the lived experience of dementia in their research. We hosted a webinar similar to this last year, which was very well received, and I'm really pleased to be able to present another webinar to the dementia research community today. We have 4 fantastic speakers lined up. I'll introduce each of them in more detail as we get to each one. But very briefly, I'd like to welcome and thank Dr. Andrew Shoebridge, Dr. Carissa Barthelson, and Dementia Advocates Bobby Redmond and Steve Rule. Joining us also is Annette Moxie, who many of you will know as the General Manager of the Dementia Australia Research Foundation. Before I hand over to our first speaker, just a little bit of housekeeping. We have allocated time at the end for questions, so please, if something comes up, put it in the Q&A. I believe that the chat is disabled, so use the Q&A and we'll get to all the questions at the end. The session is being recorded, and the recording, along with any slides and any other relevant information that we talk about, will be sent to everyone that's registered soon after the webinar. Any questions that we don't get to during the Q&A, because I do plan to finish on time, we'll attempt to answer and provide responses to those in that follow-up information. And finally, just a small word on terminology. So throughout today, the main terms that we'll use to describe a person with living or lived experience of dementia is a person with living or lived experience of dementia, or often the term dementia advocate. If you have done a bit of reading in this space, or you're experienced involving people with a lived experience of dementia, you've probably heard a bunch of other terms used as well, particularly the word consumer or lived experience expert, for example. So each probably means the same thing, but the language we use today reflects, I guess, the preferences of the speakers, but also meets the dementia language guidelines that Dementia Australia has. So I encourage you to really look at those guidelines if you haven't already, when it comes to not only writing your applications, but also in general when you're talking or reporting or writing about people with a lived experience or living experience of dementia. So the format of today will be, first we'll hear from Andrew and Carissa, both researchers, who'll speak about their own experiences working with the people with a living or lived experience and the impact that it's had on their research. I know their insights will be really, really valuable here. We know that particularly for laboratory-based researchers, involvement of people with lived experience may not seem as straightforward, and for some people not even necessary, but hopefully after today you'll see things a little differently. So I'll hand over to Andrew. I'll just give a brief introduction. So Andrew is a postdoctoral research fellow at the South Australian Health and Medical Research Institute, or SAMRI, as part of the Healthy Microbiome and Chronic Disease Group. Andrew's expertise is in the field of microbiology, with a focus on the microbiome gut-brain interactions that could be leading to neurodegenerative disease. In 2021, through the Dementia Australia Research Foundation, Andrew was awarded the McCusker Charitable Foundation Project Grant. And so a grant that's very near to being completed, I believe. And so he is, a current award holder with the foundation. So I'll now hand it over to Andrew.
Beautiful. Thanks very much, Sarah. And thank you very much for the opportunity to speak with everyone today. Firstly, I'm sure everyone here is here because they appreciate the importance of why to involve people living with dementia in their research and moving beyond what is generally called a tokenistic involvement and more of a role just as participants. And as Sarah mentioned, I also appreciate how it might be difficult for some researchers, for example, basic or lab-based scientists who do not always engage with participants or participants at all of the humankind, and find it difficult to then connect with the community. So I'm going to talk a bit about or give some tips or some advice about how to do this, but particularly from my own experience, as I myself am more of a basic scientist. And I'll just give some general tips on how to connect your research in the immediate future, so specifically around grant applications for this Dementia Australia Research Foundation or DARF funding round, as well as looking more longer term for your research program more broadly, and just finish with some of my own experiences and the benefits I gained. So firstly, talking about your funding application, and especially if you never get the chance to leave the lab, you're probably wondering, how do you even find a person living with dementia, let alone involving them with your research? It's actually not as difficult as you might think. And all you have to do really is just ask. And so one of the first strategies is Dementia Australia actually offer opportunities for researchers to invite dementia advocates to be involved with your project. So that's one opportunity to investigate. Of course, if you're looking for this particular funding round, you'll probably need to discuss this with DARF first. Another opportunity is that your research institute might actually have what they call a consumer engagement platform. And this can be a platform that connects volunteers from the community with researchers. And that's not necessarily within the dementia space, but often has elements of connecting for dementia research. There's also another approach where you could engage with your institute's media and marketing to promote your own work. For example, through a recent paper or a recent publication or a presentation you've got. If you're able to promote that to the media, that's actually really good at generating interest from the community more generally, especially if you open the opportunity to being contactable either through the institute or through yourself directly. And if you're lesser of a basic scientist and more of a clinical-based researcher, if you recruit participants, be more involved with that recruitment process personally. And you can look at individuals beyond their role as just participants and just have a general discussion with them about your project and about your research program. And also you can extend the offer and opportunity to engage those participants into a more of a partnership role with your research project as well. So I've actually been fortunate to connect with people living with dementia through these 4 ways, which has helped my research project and my research program more generally. Now, once you've tried a few of these strategies and been able to hopefully partner with or engage with people living with dementia, there are a number of areas where you can work with these people living with dementia for, firstly, just immediate impact if you're looking for your grant funding application. So if your application is early in the development phase, you could perhaps work to involve shaping the project design. For example, you could discuss if the burden might be too great for ethics approval, or discuss some strategies there. Is your recruitment strategy appropriate if you're looking at human recruitment? Or more, regardless of whether it's basic or clinical, are your research outcomes impactful and significant? If your application is a bit further along and it's perhaps a bit late to do some of these more drastic changes, you could work and partner with as a co-investigative team. And so you could, as the project moves along, you could work together as co-investigators, or else you could be seeking feedback from your application or proposal altogether. And then also you could work in later on, if your project is successful, you could perhaps have either a governance or steering committee, which can include community members, and community members can also be involved with assisting with the dissemination of outcomes. For example, you could partner together with presentations to media, for example, and can also help with some elements of the application, for example, lay summaries and things like that. And what you'll get from this, if you're just looking at the short term for this grant application, the benefits you'll see are just how your research will be more impactful and more translatable, which is a really significant outcome. And then this can then lead into involvement for more longer term for your research program, which I personally think is really important. So with it moving beyond this immediate project, you could start having discussions about the translation pipeline for your research program. So, for example, are the outcomes from all your hard work going to be meaningful or relevant to those who will actually benefit from it? Because all of us are doing research here to benefit people living with dementia. And so you want to be able to be working directly and hear directly from people living with dementia, what is important to them. And if you can and you need to be able to demonstrate how your research will help, or how you can work together to maximize the impact of your research so that it will provide the greatest benefit possible. This will not only strengthen your research for the community, it will also strengthen your research for all sorts of funding applications further down the road, even outside of the DARF funding schemes. So as I move a bit to touch now on a bit of my own experiences. So as Sarah mentioned, my research program is investigating the role of gut health in dementia onset and progression. And I've been very fortunate to have partnered and discussed my research with people living with dementia at various stages and through different avenues, including those that I mentioned earlier. And one of the main areas that I saw success was during recruitment for a pilot project, which was funded by the Dementia Australia Research Foundation. And so being gut health, it can be a bit of dirty work. So I look at stool samples. So that's the way that I can assess gut health, is through what's excreted through the stool. And that can be a bit difficult with getting recruitment and doing subsequent experiments. And so what I did was I was personally involved with the recruitment process and had discussions with every person who came through the clinics. And I was able to discuss my project and where I saw the vision of what the project was going to be like, as well as what I was hoping to do with the samples. And originally, what had been designed by people purely in the lab was requiring fresh sample frozen deposit. So it would have required people to come into the lab to produce a sample. Now that's not going to work. That's not going to have either lead to high recruitment rates or recruitment at all. And so what I was able to do was, through discussions, was work with participants as well as the community more widely, and worked out what would be an approach that would be most comfortable for them and provide the least burden and least impact on them. And so that was by developing a kit that allowed for participants to provide a stool sample at home from the comfort of their home. And then what I did was then I worked with the laboratory and partners in the labs to change our experimental techniques so that we could work with what was called preserved samples rather than fresh samples. And so we did an overhaul of our analysis pipeline so that we were able to provide the least burden on participants, and it changed our analytical pipelines. And what that meant was that participation for this project rocketed up, and people were very receptive to it. And it was also really helpful with building up feasibility, not just for the project, but other projects down the line, particularly as it was a concept, was able to convey it in more of a lay terms of like a concept that was more generally familiar. So for example, what I would find as a common language was the bowel cancer screening tool. So that's a tool that everyone was familiar with, and that was sort of the path that we went to develop along. So yeah, so this led to a really high involvement, really improved my pilot project and the outcomes from that. And yeah, it has led to some really exciting findings as a result of having a high recruitment. And so that wouldn't have happened without having personal discussions with people for this project. I've also partnered with one of the Dementia Advocates, and we've appeared on the radio together to discuss dementia and research and the importance of dementia research and working together, which was really wonderful. And it was really great at creating general public awareness. And that in turn sort of acts as a cycle, and that generates more community engagement, particularly if you're making yourself open and willing to engage more with the community more generally. And I've also had the wonderful opportunity to showcase our lab. So if you're more of a lab-based researcher and you're not able to go out and meet people, make the people come to you. And so open up your lab for sort of a tour. And so, yeah, I was able to invite people from the Dementia Australia Advisory Committee to just showcase our lab and show what we do. And it's really beneficial for both parties because yeah, people living with dementia in the community can see what happens behind closed doors in the lab, because let's be honest, what we do in the lab, while we see it as a day-to-day job, it's really, really exciting. And people are always really excited to come and have a look. And so it's a great opportunity to showcase your talents and skills and what you're working on and to bring your work to life. And it's also a great way for people living with dementia to see what you're doing and the relevance of it. And it can really bring those two together, to just yeah, really connect well. And it's yeah, it's really great at fostering collaborations and partnerships for multiple research projects. So yeah, so just as I wrap up here, I'll just say, yeah, I've received input from numerous people at various stages for my application for Dementia Australia, as well as continually for building my research program, which has helped leading into subsequent research projects and funding within the scheme and outside of this scheme. As I myself now know the importance and impact of my work, as well as how that's been improved by working with people living with dementia. And I'm able to convey that effectively to the community more widely, as well as other funding bodies and the media and so on. And it's also, more personally, I find it really motivating, and it's really great to have that human connection, because often as researchers, we don't often get to see the people that we might be benefiting. And so it's really great to be able to yeah, have that connection of humanity with our research, which yeah, I find yeah, really wonderful. So yeah, I'll just conclude there.
Thanks so much, Andrew. That was great. And I think, as I mentioned at the beginning, the fact that you do a lot of basic science and in the lab, I think is really, yeah, it's really great to hear your experiences and the benefits that you've had from involving people. So thank you so much. I'll pass now over to Carissa. So Carissa is also a current grant holder with the Dementia Australia Research Foundation. She's a Race Against Dementia Australia Research Foundation postdoctoral fellow based in the Childhood Dementia Research Group at FMRI, the Flinders Health and Medical Research Institute. So using a variety of disease modelling systems, including cell lines, zebrafish and mouse models, her research aims to understand shared mechanisms between adult and childhood onset dementia, with a focus on Alzheimer's disease and Sanfilippo syndrome. So I'm really pleased to hand over to Carissa. Thanks so much.
Great. Thank you so much for that, Sarah, for that very kind introduction, and both to Sarah and Annette and the Dementia Australia Research Foundation for giving me the opportunity today to reflect on my experience of involving people living with, or the lived experience of dementia. So Sarah very kindly kind of gave a brief intro about my background. So I'm very much a lab-based researcher. My main model organism is zebrafish, and the occasional human cell line type experiment, and eventually some mice. So you're very lab-based and very far removed from the clinic. And really before the fellowship, I had essentially no consumer engagement experience whatsoever, let alone interacting with people living with dementia. So during the fellowship application process, the question of how are people living with dementia, their carers or or the general public be involved, this was actually quite confronting for me. I'm very much a lab molecular researcher. I didn't really understand why I should be involving people living with dementia in my research, and I really struggled on what to do to address this in this application. And yeah, to be completely honest, it did feel a bit tokeny to begin with, but we'll get to my seeing the light a little bit later. So I asked around on what I should do, and I realised that I have a really good relationship with a patient advocacy and group called the San Filippo Children's Foundation here in Australia. And they've funded my other project grants in the past, and I know that they have a really good patient registry of all children in Australia who have Sanfilippo syndrome. So I reached out to this organisation and asked them, would you be able to put a call out to see if any parents would be keen to have a chat with me about this fellowship application and whether they'd be keen to give me some feedback. And fortunately, 3 families put up their hand and said they would be really happy to listen to me speak and talk about my research. So that was great. And I was like, okay, so I've got a Zoom meeting with these families. Now I need to prepare a presentation for them. So I put together some slides, and I actually spent almost as much time preparing these slides for these families as I did the actual application for the fellowship, because it was really important for me to clearly convey what I was trying to do accurately, but also in a lay manner that could be understandable for these families who don't have a scientific background. So the presentation was about 10 minutes in length. It covered the background, so I set the scene for the ideas I was about to present, the aims of the project, the methods I was going to use, and the outcomes that if everything was successful, this is what I would be producing. I tried very, very hard to keep things very high level when it came to the technical scientific aspects of this talk, and tried to use a lot of analogies and similes to kind of get ideas across without getting too technical. Showed them some videos and stuff of like how I'm doing all the different parts, bits and pieces, all the different experiments. And I practiced this talk a lot. I wanted to make sure that everything was coming across really clearly. So I had run-throughs of this presentation with other scientists, and importantly, people who weren't scientists. So my mom, my partner, my friends, like anyone who would listen to me, I would have a run-through. But practicing with the non-scientists was probably more informative, because they were the ones who were telling me, oh, this part's way too technical, you need to simplify that, or you lost me here, can you clarify what you're trying to say there? So yeah, having a consultation type call with families of children living with Sanfilippo was the way I was going to address this part of the fellowship. And it still felt quite tokeny to begin with at this stage before the call. So during the call, it was me, the families, and I had a representative from the Sanfilippo Children's Foundation in the call as well, who was like they knew her quite well and I knew her quite well. So she was like the mutual friend of the call, just so everything was keeping on track. I gave the talk and I stopped frequently. I gave like the background and then I stopped for questions and discussion. And this was partially so the families weren't overwhelmed with all the information at once. And it gave them time to reflect on what I just told them, and we can make sure we were all understanding each other and all on the same page. Then we would do the same after the method. I'm going through each aim and then the outcomes. This worked quite well because, yeah, we had lots of deep discussions, and they would stop me straight away if they didn't understand. So, if they had a question, if they had a question about something, we could just stop and talk about it straight away. Overall, the families loved it. They were so fascinated by the work. And to be honest, I've never had a more engaged audience listening to one of my talks. And they were particularly excited to hear that these adult onset dementia charities, like Dementia Australia Research Foundation and Race Against Dementia, these charities that are typically thought of an adult onset dementia charities are now willing to support research that includes Sanfilippo syndrome. So yeah, we spoke a lot about their lived experiences of having a child with Sanfilippo syndrome. So at the time, I did know a little bit about the symptoms of what these kids would experience from the literature, but actually hearing their stories of what they've gone through from when they have had their child, their birth of their child, which is such a happy moment. It's often their first child too. Then the story of how they go through this diagnostic odyssey, like they do not get a diagnosis for years. And when they eventually do get this diagnosis and find out there's no cure for this disease, it's absolutely devastating. It got quite heavy, quite emotional. There were some tears involved. But it was in that moment, that's when I realized this is why I needed to start talking to these people who live with dementia and their carers and their families. It is so, like Andrew alluded to, it is the most motivating aspect of my research is talking to these people and engaging with them. And it makes it feel like instead of just mucking around and playing around with fish in a lab, that we're doing this for a reason. And putting the faces to the people who are eventually going to benefit for this from my research is just, yeah, the most rewarding and motivating experience of my life. We also, we need to understand that the research we're performing is actually going to translate. So in my research, I'm looking at repurposing drugs that are already out there for both Sanfilippo and for Alzheimer's disease. And when I ran through what these drugs were, the families did agree that this is something that could be suitable for their children. But the example I like to give is something like wearable sensors for children who have Sanfilippo. Sanfilippo children can get quite hyperactive and they would never wear a watch. They would just rip it off. And so what would be the point of wearing wearable sensors for a child who lives with Sanfilippo syndrome? So it's like these kinds of things you need to talk with your consumers about and the people who live with dementia and their carers to see if what your research is actually going to be translatable. And yeah, similar to how Andrew's gone back and then gone back to the drawing board and redesigned aspects of your research. So yeah, the last thing I wanted to say about this consultation session was that it was useful to have a representative from the foundation there because my research was about testing repurposed drugs in animal models. It was important for someone there to reiterate to the families that this is really early stage research and there is a possibility that the therapies that I was testing could actually make things worse and not better. This is the point of doing the research. So it's important that the families understood that, yeah, don't go start giving your kids these drugs now when they haven't been tested properly. And it was also good to reiterate to the families that repurposed drugs may not be the cure. It could just be something that slows down the neurodegeneration. So this would help like manage their expectations of whether this when this research was being performed and the outcomes that were proposed to them. Okay, so yes, the consultation talk was like one of the most rewarding and memorable experiences of my life, and I'm so glad that Dementia Australia set me on that path. These families then were also kind enough to read my lay summary of the fellowship application, and this is something that could be quite easily done for them. I sent them a copy. I'm like, can you return it to me within the week before the application was due? And all three of them had some really nice feedback about that as well. Then when I was shortlisted for an interview, they all tuned in for a run through of my interview presentation, which was really wonderful. And yeah, they had some nice quotes that I could, they wrote down some quotes for me to include in my interview presentation. So that was really kind of them. So they were, yeah, in summary, they were just a massive help to me throughout the whole application process. And yeah, as a lab-based researcher and having this consultation committee throughout the whole process was so rewarding and so valuable. And yeah, I'm forever grateful for those families. Since I've started the fellowship, we've actually found it really difficult to find Zoom times for all of the families and I to stay together and keep catching up. But I am quite fortunate that the Sanfilippo Children's Foundation holds an annual conference that families, it's a research scientific meeting, but families also attend. And this is where I catch them up with my research and like they'll listen to my talks and then I'll go through it with them during the breaks. So that's my way of keeping in touch with them and making sure that I have that continuous input from them. And I was, like Andrew alluded to, I was fortunate enough to do a lab tour for these families as well. So showing them the fish, getting them on the microscopes, it was, yeah, quite a lot of fun. And they also all loved seeing how the research was performed. So yeah, doing a lab tour for lab-based researchers is a really brilliant way to get people involved. Yeah, so yeah, in summary, I didn't really see the point of including people living with dementia before this fellowship started, and it's all thanks to DARF for setting me on this path. And now it is, yeah, one of the most special relationships, I think, in science. And I've become these really wonderful friendships of their families and me just because of this research project. So I'm very lucky for that. Okay, thank you very much.
Thanks so much, Carissa. Really appreciate that. And if I can say, include Andrew as well, I know that researchers watching will be really grateful for your openness and sharing what you actually did. I think the research world can be every person for themselves, and so it's really fantastic that you both were so open to sharing with people about what you've done and what's really worked so well. So thank you both. We'll now move on to the next bit of the webinar. I guess we've heard from a couple of researchers, and now I sort of want to focus on the dementia advocate perspective. So we've joined by Steve Rule and Bobby Redman, and I've just got a brief introduction that I'll read about both of them. I'll start with Steve. Steve has been a Dementia Australia Dementia Advocate since 2021. He's involved in many aspects of advocacy. He regularly speaks at staff education events, both for Dementia Australia and also for other organisations. He has worked with his local library to create events where local community members can come and meet with him to gain insight into his experience of living well with dementia. Steve is actively involved with the research and regularly contributes his expertise, which we'll hear about, to research projects, as well as being a participant in them. Steve chooses to participate in advocacy opportunities where possible because he wants to share with people how he lives well with dementia. So we welcome Steve. We also welcome Bobby Redman. So Bobby is a retired psychologist living on the central coast of New South Wales, and she was diagnosed with frontotemporal dementia in 2015 and is determined to improve the lives of people living with dementia and is passionate about her consumer advocacy work. She's part of a number of research steering committees and works with the University of Sydney, University of New South Wales, Flinders, and a bunch of other universities, and was a finalist for New South Wales Senior Citizen of the Year for 2020 in recognition of her significant contribution to senior Australians and people impacted by dementia. So both Bobby and Steve are on the Dementia Australia Advisory Committee, or the DAC as we call it. Bobby has been a member of the DAC since 2017 and Steve since 2023. And so the DAC committee, they aim to be a catalyst of change where people living with dementia are valued and respected. And Bobby is currently the chair of this committee. So I'm so pleased that both Steve and Bobby have agreed to speak with us today. As I mentioned, we've got sort of a question and answer session, which we'll get into now. My first question is for Bobby. So, Bobby, as we've heard from Carissa and Andrew, researchers can involve people with a living or lived experience at any stage of their research. But can you talk about your experiences in being involved in a project at the pre-award stage?
Yeah, thanks, Sarah. Thanks for the opportunity to speak today. I was really impressed with both Carissa and Andrew's attitude to it. I've been involved in dementia research as a person with a living experience for the past 8 years. In the beginning, it was very difficult, and it was very much about ticking the boxes, I think, in having us involved. And people didn't tend to involve us at the early stages. But what I'm noticing is because of organisations like DARF that are really talking about the importance of involving us, it's happening a lot more. And of course, as researchers get to work with us, they tend to come back to us as well and say, oh, look, I'm doing some research in this area, and can I just have, can you spare me a few minutes to have a bit of a chat about, doing the presentation, putting my grant together, and have I got the wording right, and do you mind reading through and quoting back? So this is happening more and more. I've got one young researcher, he's young to me nowadays, but I first worked with her 7 or 8 years ago, and she now comes to me. She has some wonderful research, and each time she's working on a new project to sort of expand her knowledge, she'll contact me, and I've sort of watched her have a baby, and her child's now at school, and it's as Carissa said, we develop friendships. We become part of a team, really and truly. But even more senior researchers will often give me a call and say, look, I'm doing some research. I know this part's going to be a bit controversial. Is this wording going to be too offensive to people living with dementia? I need to be able to describe this, and I want to know, test out some things to see which is the least offensive for you guys. But to actually have the respect to ask us these sort of questions, it really impresses me. I never get offended by things that people say, because I recognize that researchers are finding their way, and they're really wanting to find the answers that are going to help us in the long term. But if they could involve us and get us to sort of help to put their grants together, or to put their applications there, make sure that they're covering all the angles and they're right on track. It's great that they're contacting us, and I really encourage it. And yeah, it's lovely to see that the reluctance becoming less so.
Thanks, Bobby. Steve, I'll go to you now. I know I mentioned at the beginning that you're involved in a number of research projects at the moment. Can you just talk to us about the types of roles that you have had or currently have?
Yeah, sure. Thank you for everybody being here. I think just before I do that, I might mention that I've got Alzheimer's. I was diagnosed officially in 2021. So my involvement in the projects that I'm going to speak on now have really come about because I have had a diagnosis. And I just want to comment that there are so many versions of our wonderful disease that in dementia that are not diagnosed. That sometimes I think it becomes difficult for the undiagnosed people, or the people who have different outcomes to mine, probably find my input quite weird. So, I mean, I do a lot of work. I do a lot of speaking to hospitals, and, as we said, different outlets in the community, just to provide a capacity for people to talk about things, because I have a wonderful, well, in my head, a wonderful life, where I just don't regret anything that's happened. I'm not worried that I have a life-ending disease, which I have, because there are so many people way worse off than me, and I've got a lovely family, and my life's great. So so I work with different universities at the moment. A few of you probably will know of the early project that's run through Uni New South Wales with Craig, and I can't think of his surname now. But my role in that, or my role in being involved in that, is simply because it's being run in its initial stages in New South Wales and WA, and it applies specifically to the 18% of Australians for whom English is not their first language. And I think that's such a wonderful, that's to have a starting scenario where you are dealing with such a minute percentage, but such an important percentage, and I love that. So that's what I do with them in New South Wales. For Uni New South Wales, when it gets to my side of this, in the actual practical side, it's going to be to work with linguists who are going to go and see the people that are designated by the care providers, and who apply personally, I guess, to try and soften the attitude of to make sure that they're not frightened by or attempt to, not frightened by what's going to happen. And I'm really looking forward to working with them on that. That recruitment won't start for another couple of years, so who knows what's going to happen there for me. I also work with Monash Uni on CREED, which is an enhanced dementia diagnosis program. And that, the CREED specifically looks at existing study processes and the areas that they're working in to research new options, primarily around the blood testing, cognition and MRI regimes. I've also worked with Macquarie on a younger onset dementia and MND, which is new to me, so, which is something I've never been involved with before. So these have come about because the university seems to have a very, very sharing attitude towards somebody that is living with dementia who can actually speak quite well, which I'm very pleased that I am able to do that. I had a life of speaking to people. My work was around that sort of side. So I really value what I do, which I hope brings other people to the same level. And I've got a few friends. I live by the credo that you've got to maintain your friendship group. You've got to keep rolling, regardless of whether it's going in your favour or not. But what I wanted to say was really clearly that there's lots of people who are living with dementia who sit on advisory groups for these universities who come from Dementia Australia Advocates around Australia. So I get to meet some people who I wouldn't otherwise possibly meet, and who have completely different disease to me. It might all be dementia, but some of it is, you wouldn't know they were on the same planet, quite frankly, or I'm on the same planet. And I think this, at the end of the day, if I hadn't been involved with Dementia Australia, I don't think I would have achieved anything in the area, probably, if it hadn't been for Bobby and the DAC team and the different people around Australia who have helped me. I wouldn't be as comfortable as I am where I'm working. And that's pretty much my bit.
Yeah, thank you, Steve. I was gonna follow it up about what is it about these roles you particularly enjoy. You've already touched on the fact that you find great value in being able to contribute and you love the difference that you can make. Is there anything else that you wanted to add, or have you already captured it?
Well, because I've been through several drug studies, and the last one was aducanumab, which was removed off the market 8 to 10 months ago. To be involved in that way and in as much of the study area as you can, the research side, is important to me, because you've got to have something to hang on to until the reality turns up. But with I don't know how many studies there are going on in the world in any given time, but there are heaps. And with, pardon my rude attitude towards this, but whilst there's money to be made out of drugs because there's no outcome, there's a lot of happy drug companies. So, yeah, that's my bit.
Thanks so much, Steve. So Steve and Bobby, we've both heard, I guess, about some of the good experiences that you have or can have working in research. And so, Bobby, can I now ask you just to talk about an example where perhaps your involvement in a research project has not worked so well. These are often good learning opportunities.
Yeah, look, generally, I think things go pretty well. Sorry, that's why my reminder going off in the background. I apologize. Yeah, basically, the two problems that crop up really. One of the problems was basically you're invited to be part of the investigation team. They do an interview at the beginning with you, and you do a nice video, and everybody's happy. And then they disappear, and they don't ask you any questions about anything. And that, for me, shows that we're ticking the box, and I get really frustrated. And I usually sort of contact the chief investigator and say, look, am I part of this research, or have I done my bit by just saying I've got dementia? Because it's not what I want to be doing. So that's really, my number one hate. But I was involved with a project that it was with all good intention, and we don't often talk about over communication because we know the importance of communication, but this particular research project involved a really, really high number of researchers. It was designed in preparation for putting out recommendations pre-COVID for care of people in hospital with dementia. And there were many. I mean, I think there were probably over 50 people involved in this project, and they had one document that was circulating for us all to read and review on. So you can imagine, with 50 people involved, this particular one document would come out to us like 20 or 30 times a day, where people would make minor adjustments to what's got to be said and their part of it. So there was this document with all these different colours on, because everybody had a different colour. And by the third day, I thought, I'm going to die of exhaustion. It's just trying to keep up with my emails on top of everything else. And there were 5 of us with dementia involved in this project, and we all sort of felt the same way, and ended up getting in touch with the chief researcher and saying, we can't do this. There has to be an alternative way. Even if we only get one email a day, or one email every other day, or questions that are really relative that we can give feedback on. So yeah, just be conscious. And I don't know how many of you would be doing research with that many people involved in the project at this stage. But if there are a number of people involved, just be careful that you're not bombarding the people with the lived experience. We do, we have got our own health issues that we're trying to work with at the same time, and it just makes it too hard on us. So that would be my one recommendation.
Thanks, Bobby. I mean, we can all relate to getting too many emails, can't we? That sounded quite hectic. Just to finish off, and I am looking at the time, so just briefly, I'd really be interested in you, Steve and Bobby, just giving what would be your one take-home piece of advice for researchers, either as they're preparing their proposals or conducting their research, or anything in general. So, Steve, what would be your one take-home piece of advice?
Look, I think it's so difficult, and I'm talking Alzheimer's because that's my area of fun. I think that the primary research which has been applied around the world is looking at looking at tau and amyloid, and I recently had when I was diagnosed, I had very, very high levels of tau, and I went onto a drug which then was summarily just dropped off the market about 5 months ago. But what I would suggest is that if people are researching in the areas that are already partially understood, or probably more than partially, but amyloid and tau are areas, that they make sure that their processes and how they're going to improve possible outcomes or whatever it happens to be with an with a project that's already working to an extent, to be very careful and clear with what they're wanting to, or what they can achieve by whatever it is they're suggesting. Make it as clear as possible, have timelines and the logic, obviously, but logic, timelines and progress to date to be in it as well, so we know how far it's gone at any one time. I think you've muted yourself,
Yeah,
Sarah.
okay. Thanks, Steve. Bobby, do you have any final parting words?
Just very briefly, don't underestimate us. We're more than our dementia. We live with dementia, but we have backgrounds, we have different educational levels, we have different life experience, and we can bring a lot to the research. But the one thing that we can bring that nobody else can bring is the insider knowledge. We really know what it's like to live with dementia, and by involving us and our carers who have their own experiences of our dementia, it's vital, and it's going to make your research richer and more meaningful, and it's going to give you a better understanding as well. So, don't be afraid to work with us. Thanks.
That's great. Thank you. Thank you both, Bobby and Steve, for sharing your experiences, not only as people living with dementia, but also as people who are involved in research. We really appreciate you being here. Next speaker is me. I think I'm just going to talk. I don't know if my slides were working, but basically I just wanted to share with you some of the more common feedback that we've got from both advocates who are members of our scientific panel, who are involved in reviewing the sort of lay summary paragraphs of your applications. And having been involved in those meetings and heard discussions, I thought giving some feedback about some things that you should consider doing when you're writing about how to involve people with a lived experience in your research, as well as some things that are not so good to do. So just as a reminder, the 4 paragraphs I'm referring to, and the one in particular about how you will involve, need to be written in plain English, and you've got 250 words. And what these paragraphs are for, or what this paragraph is really designed to do, is to allow you to show the ways that you have already involved people with a lived or living experience of dementia in your research. So you might have involved them in the pre-award stage as you're developing your ideas, or perhaps in the ways that Carissa mentioned as you're developing your application, but also the ways that you plan to involve people as well. So assuming you get funded, what your plans are around that. And one of the main things I will say is that it's really important that you are specific, particularly around your plans for what you will do if funded. We see in a lot of applications researchers saying, I will involve people with a lived experience in it at every stage, but not providing much more information beyond that. If you can say that you've already spoken to people and that you've got these ideas to set up an advisory group that might meet on regular occasions to discuss these aspects of the project, or to have oversight of particular things or at particular stages, then that looks much better, like you've given it some real genuine thought and consideration, and it's a much more feasible plan than one that says, of course, we will involve people with a living experience of dementia going forward. Other things, so being specific is really important. I think we've heard from 2 sort of basic or lab-based researchers today that show that truly it might look a bit different, but lab-based researchers can involve people with a living experience of dementia in their work. And so it really doesn't cut it to say, I'm a lab-based researcher, so there's no scope for direct involvement. That's really not the case, and certainly when those aspects of the grant are being reviewed, that's not looked upon terribly favourably. Another common comment would be that because you're doing a study that involves humans or people living with dementia or carers as participants, that's not the same as involving people in the design or the decision-making aspects of your research. So having research participants who have a lived experience is not involving people. And so that can't be the way that you address that particular part of the proposal. And the other thing that I'll say is that lots of researchers tend to spend a lot of that section talking about all the different ways that they will inform people about their research, including people living with dementia in the community. And of course, that's really important. But informing people, just telling people, not having a two-way interaction or discussion or anything like that, is not really involving people either. And so even if your institute's media team has got a great Twitter or X platform, or has got good ways of disseminating findings, that's fantastic, except it really needs to be a two-way interaction to be counted as involvement. So I guess they would be the main bits of advice that I would offer, is keep it really specific. If you're a lab-based researcher, then there really isn't any excuse for not discussing or genuinely thinking about the ways that you might involve people with a lived or living experience, and to really give some consideration to involvement that goes well beyond just informing people about your work. And hopefully after today, you've got some great ideas about how to do that. In the materials that we send out after the webinar, there'll be some information about how to get in contact with us here at Dementia Australia, with me probably, or I've got a fantastic new colleague, Courtney, who you'll speak with one of us about involving people with lived experience in your research as you're developing your applications. I'll also suggest that there's a lot of great general consumer involvement resources, and I'll have links to those in anything I send out. But there is a dementia-specific resource which was put together by the Dementia Centre for Research Collaboration, or the DCRC, which I would recommend that you go to in the first instance. So I'll finish there. Annette, I think there are a few questions we've got for the last couple of minutes.
Yes, there is. Sorry, I was just adding everyone to the spotlight. That was such a fantastic presentation by everyone. I just thought that was so useful and so interesting. We've got just a couple of questions that we might be able to get to in the time we have remaining. There's one here directed for Andrew, or maybe Carissa can answer as well, is how do you navigate research ethics when initiating a conversation with a current research participant about becoming more broadly engaged as a research partner?
Yeah, it's a good question. I mean, it wouldn't perhaps be an direct involvement for that, well, speaking from personal experience, wouldn't be involvement for that direct project where the ethics are tied to. It would be perhaps looking forward for future projects. But then, yeah, if that's what I'm understanding, if it's like the question is around a breach of ethics for that particular project, if that's how I'm interpreting that question, yeah, it wouldn't be involvement or partnership for that direct project. It would be for subsequent projects, and that's sort of how the partnership would develop. So there'd be more involvement as a participant for that project where it was the initial approach, and then, yeah, it's more a partnership for downstream projects.
Yep. A couple of the questions have been answered as well in the chat, but if we have some time, we'll get to those. And one here for Carissa. Can you share a brief process that you involve persons living with dementia, or perhaps any publication about this?
That's a great idea, to write a publication about it. Yeah. So yeah, I guess the main points of what I did was pre-award. I approached the Sanfilippo Children's Foundation, but also approaching Dementia Australia Research Foundation is another way you could do this, to form a committee of people living with dementia, or their carers or their families. Prepare the lay presentation to show them your research. It's better to show rather than to just speak like this. You want to like show videos and diagrams so you can point to stuff. Get their feedback and take it seriously. That's one of the most important things. Don't just dismiss it, and you need to understand where they're coming from and why they want you to change what you do, and do your best to incorporate everything they tell you that they think could be improved. let them read through as much as you can of any lay summaries, and even like papers or future talks at conferences and stuff like that, if they would be willing to have a read of any documents or have a listen to any talks. And then, yeah, importantly, trying to involve them post-award. So that, yeah, it is difficult, especially with like people living with dementia and their families. They're busy people with busy lives, but just do everything you can to try and stay in touch with them. And if you have any more like specific questions, please do reach out to me. My information's on the Dementia Australia website.
There's another question here for perhaps Carissa and Andrew. Maybe this might be our last one, is about, because it seems to have come up a bit, about engaging ethics committee approval before you have conversations with families into the lead up of your application. Are there any sorts of hints or steps that need to be taken there?
So this is a bit of a grey area because it's not research specifically, it's just a chat about research. So I didn't engage with human ethics committees for this. I went through a San Filippo Children's Foundation. So yeah, maybe it's best for each institution to, if you were like worried about this, to speak with your institution's human ethics committee to see whether it would be approved or not. But I hope it wouldn't, because yeah, that's another thing you have to do before you get the grant application over the line, like get your grant application submitted.
Yeah, I agree, Carissa. And I mean, this can be a personal opinion, but I mean, ethics committees are in place to make sure that, that people, or whether it be humans or animals, are just not being burdened by researchers, and certainly the interactions that I've had, because yeah, it's just a general chat, and it's been very engaging, and it certainly hasn't been perceived as any ethical issues. But yeah, I think perhaps if someone is concerned, can have chats with their institute. But yeah, I don't think it's
I don't think, I agree, Andrew, I don't think it's required of ethics approval.
Yeah.
Thank you so much. If there's any other questions in the chat, we can arrange a response.
Okay, I think we'll finish here. I apologise, we have gone a few minutes over, but I can see most people are still with us, so I really appreciate it. I'd like to say one final thank you to all our speakers today, Andrew, Carissa, Steve and Bobby, and of course to Annette for facilitating. Best of luck everyone as you prepare your grant applications, and I really encourage you to get in touch if you need support or help with how to best involve people with a lived experience in your research. So have a great weekend.